for being here today. Welcome to Lincoln Trail District Health Department. My name is Sarah Jo Best. I'm the Public Health Director for Lincoln Trail District Health Department, a regional public health agency serving Hardin, LaRue, Marion, Meade, and Nelson and Washington counties. First, I want to let you know that responding and investigating communicable diseases is one of Lincoln Trail District Health Department's core functions. We do this each and every day in our communities. Most people just don't realize we're doing it. We receive over 100 communicable disease reports a day. We get a lot of practice. However, communicable disease investigations are not done in a vacuum. We need our community partners. So our established partnerships and continued collaborations with our local community and our government leaders increase our ability to act efficiently and quickly. Currently, there are 8 cases of corona disease 2019 or COVID-19 in the Commonwealth of Kentucky. Harrison County has 5 of those cases. Fayette has 2, and Jefferson County remains at 1. To date, public health officials have monitored over 200 individuals. 54 of those have required testing. None of these individuals reside within the Lincoln Trail District. Again, Hardin, LaRue, Marion, Meade, Nelson, and Washington counties. Local and state public health officials will continue to monitor and prepare to promptly respond to any potential cases should they occur. I'd like to turn it over to Dr. John Godfrey, Hardin Memorial Hospital Vice President and Chief Medical Officer.
Thanks, Joe. Hi, welcome everybody. I was asked to come and provide somewhat of a medical perspective of what's going on with coronavirus, what it is for those that are a little unfamiliar with it, a little bit about how it has gotten here, how it's going to impact the individual as well as the community, and then what are we doing about it and what can we do about it from a medical perspective. So coronavirus is a well-known virus in the medical community. It typically creates very mild symptoms, typically respiratory type symptoms, nasal congestion, runny nose, cough, sore throat. Typically when folks acquire coronavirus and they seek medical care, it's the common phrase that doctors will say is, oh, you just have a virus. So it fits into that category. There's multiple other viruses that cause similar symptoms. But what has happened this year, and this happens periodically with viral illnesses and bacterial illnesses, is the virus has changed. And that change started over in China, in the city of Wuhan, and it has significantly impacted their country and multiple other countries, as everybody knows. So as it has mutated or its biology has changed, that has created a situation in the human race because our immune systems haven't seen that virus yet. We have an innate ability to protect ourselves from viruses and bacteria, but when we are exposed to something new or different, then it can overwhelm the immune system. Thankfully, the coronavirus is typically causing very mild symptoms. 80 to 90% of people that are acquiring this illness are getting very mild upper respiratory symptoms. They are not needing health care. They are able to get their care at home. But some of the people that are significantly impacted are those most at risk. Those include the elderly, people with compromised immune systems. Those include people with chronic illness such as diabetes, heart disease, lung disease, and I think of emphysema, severe asthma, I think of COPD. Also think of chronic kidney disease, and immunosuppressed folks. So if you're on medications that would suppress your immune system, so those are the people most at risk. The good thing is what we know, this is not impacting children. Children, for various reasons, are felt to be protected. In China, the vast majority of folks are in the adult and elderly populations. So most of the kids are not affected by this. So that's a good thing for the school leaders. And it doesn't necessarily make an impact on whether to close school or not. It's not the high-risk populations like nursing home settings. So when people acquire this, there is an incubation period that we say that averages about 5 to 6 days, but that can last anywhere from a couple of days all the way up to 2 weeks. And that incubation period is where it's in our system, we are unaware of it, and we can actually spread the virus unbeknownst to ourselves and others around us. So that's part of the issue here, is that like most viral illnesses, even influenza, we are spreading it and infecting others around us even though we are not feeling well. So that's part of the dilemma that we're faced with, is knowing when people are infectious and when they might be spreading illness. So when the symptoms start, we're calling it flu-like symptoms. What does that mean? So think of body aches, think of fevers, think of headaches, malaise, or just feeling unwell, weak, tired all the time. A lot of people have a cough, scratchy throat. About 10% of people are presenting with GI symptoms, such as diarrhea, possibly nausea and vomiting. But that's not the usual suspects, if you will. And the key that's differentiating this from influenza, I think probably everybody in the room has had the flu. It typically hits pretty hard, pretty fast, and you know it within 24 to 48 hours that you've got something going on. The people on the West Coast and in China are saying this is presenting a little more slowly. It's more insidious, and so these mild symptoms will progress for a week or so, and most people, I think, are just experiencing symptoms of a cold. But then the symptoms will take a turn for the worse, more severe short and severe occurs, and so that's when the people get really, really sick. And it's in the second week that people are developing the really severe portion of this illness. And again, who gets that severe portion? It's typically the elderly, immunocompromised, and those with chronic illness. So when people present to healthcare, typically they expect a rapid evaluation and rapid diagnosis. We don't have that right now. That's the other part of this dilemma. In this age of technology where we can get results so quickly, we have tests that can diagnose the flu and strep throat within minutes, really, able to give people a diagnosis before they leave the office. While our government leadership are saying to the country that we have testing widely available, in Kentucky it's not widely available, and that's part of our other dilemma, is how do we make the diagnosis? So as it stands right now, the state health department has really tried to restrict this to those that meet certain screening criteria, and those specimens are then sent up to the state lab for processing, and they have a fairly rapid turnaround time once they get the test and turn it around in about 4 hours. Some private companies are also developing tests, but they are also experiencing huge requests across the country, which is contributing to our dilemma to acquire those tests. So we are faced with, how do we test when we don't have all of the test equipment in our state? The state health department, we're taking their lead on a lot of this, because we're just doing the best we can with the resources that we have. And so then it comes back to a clinical diagnosis of, do you or don't you have, and there are certain indicators that we are educating our medical staff on as to what to look for. What I said earlier, though, the vast majority of these people are having mild illness. One of the things that we want to really emphasize is, if you're well, don't seek health care just because you think you want to get tested. If you're worried and well, don't seek health care. If you're slightly unwell and you normally wouldn't get health care, don't get health care now, because all that does is stress the system that we really need to have in place for those that truly need it. At the hospital, Sharon and I and others, Dennis, Myra, that are here, we say this is what we do every day. We want to take care of the sick people. That's part of our mission in life, is to help. So that's what we do every day anyway, and so we want to care for those people that most need our help. So again, I think the big message here is, if people are slightly unwell and not typically needing to seek health care in their usual day in, day out activities, don't seek it now, because Tylenol, Motrin, those go a long way. Stay away from folks if you can, and then you are gonna recover. And if not, things take a turn for the worse, that's when we come in, and that's when we need to see you from a healthcare system. We've got ER physicians, we've got urgent care physicians and nurse practitioners, our doctors in the hospital that are more than capable of handling this. As the illness progresses, if you are sick, what happens? It's mainly respiratory issues. So we have abilities to support and care for folks. There is no formal treatment right now for this. While lots of things have been tried in the various countries, nothing has really proven that effective. There are various antiviral medications that are commonly prescribed for flu or HIV, and lots of different regimens have been attempted, but so far nothing has been reported to show significant benefit. So that gets us back to supportive care, which is supporting one's oxygenation, helping their breathing with medications, giving them appropriate food and nutrition, and just taking good care of them holistically. So, I think that's about it. Is there anything else that I should add? Sarah Jo? Okay, I'll turn it over to Sharon Wright, who is our Chief Nursing Officer and Vice President, and she wants to share with you what our strategies are at the hospital to help with this situation.
As he said, my name is Sharon Wright. I'm the Vice President of Patient Care. My background is critical care and emergency nursing for over 30 years. And my goal is to lead the strategic task force for COVID for Hardin Memorial Health. First, I want to tell you that our job is to handle infectious diseases every day. We have infectious diseases in our facility today. We handle all comers, whatever the illness is. It's also our goal to be prepared, and we prepare for the worst. We have contingency plans for everything. I often say that we're a city within the city. If the phones go out or the water goes down or there's bad weather, we have a plan to continue to operate and serve this community's health needs, regardless of what the crisis is. I'd also reinforce that there are no cases in Hardin County. We are still in that state of preparedness and readiness. We started screening patients the end of January. That was a recommendation of the CDC. We have modified that screening multiple times based on CDC's recommendation. Those screening processes included the country of China to begin with. It's now expanded to 5 countries, and now we're learning that patients can acquire it through community contact, not just travel. As you know, there have been facilities that they've identified the source to be a local business. So you really can't rule in or rule out a patient based on travel. We started about a week and a half ago with a task force to identify how our system of healthcare would provide services throughout the community. That task force meets every day under my direction, and we have about 12 subgroups or committees that are working. Those range from lab services, pharmacy services, surgery, our emergency preparedness partners. How do we make sure that we're prepared for the very worst and hope that we never have to implement those plans? And then the last point that I would make is we really work into the direction and partnership with our local health department. They have had open communication. They have helped keep us very well informed on the CDC advisories and the Kentucky Department of Public Health advisories. As soon as we receive those, we review them and put them in practice as soon as possible. So a lot of commendation to Sarah Jo and her team and how prepared they are to help us help you.
So Lincoln Trail District Health Department, along with other health departments across the Commonwealth of Kentucky, did operationalize our emergency operations centers within our health departments across Kentucky. We did this in an assessment and monitoring mode, the lowest level in our operations centers. That is currently still where we are. We are in preparation mode. We are monitoring, we are assessing, we are keeping up to date on information, and we are monitoring. I do believe that eventually we will move into response mode. I think that that's a pretty pretty expected thing for us to happen. But at this time, we do not have a case. When we do have a case, we have plans and preparation to activate our response plans and to take care of that, just like we do with any other situation. We are in close contact with our community partners. We are conducting meetings just like this with our community partners across all of our counties. So what I want your take-home message to be is, as this situation continues to evolve, we want to make sure that the information out there that you are looking at is reliable. And so there are four main sources that we're going to really drive you into. One is the Centers for Disease Control and Prevention. This is a rapidly evolving situation. It changes constantly, and my staff and I, we're on this, monitoring it frequently. Do not try to reinvent the wheel. Go to the CDC website. That is the guidance that the State Department for Public Health, our Memorial Hospital has told you that is the guidance they are using. That is the guidance that Lincoln Trail District Health Department is using as well. That is cdc.gov/coronavirus/2019. I also would recommend the Kentucky Cabinet for Health and Family Services. They are using, again, the CDC website, but they are updating situational awareness of what's going on across the Commonwealth of Kentucky. So if you want specific information about Kentucky and how our communities are handling this situation, that is the website that I would direct you to, which is Kentucky COVID, COVID-19.ky.gov. Lincoln Trail District Health Department updates our website continuously too as the information evolves. We are at ltdhd.org. Again, following CDC guidance, following the state guidance for the Department for Public Health. But if you want to see what's going on here locally within the community, that is where I would direct you. Hardin Memorial Health, hmh.net for specific information about Hardin Memorial Hospital. There is also a general public hotline that's available 24/7, which is 1-800-722-5725. So if you are worried but well, or if you are not feeling well but otherwise would not seek health care, we would encourage you that if you are concerned that you call that public health hotline, again at 1-800-722-5725. And I cannot close without acknowledging that one of our biggest partners that plays a role in this is the general public. Please know that it is not just the responsibility of the public health system, government leaders, or healthcare providers to combat this disease. We can't do it without your help. The actions of the general public can either hinder or assist in these efforts. The public's role will have a huge impact on reducing the spread of transmission of this disease. It is your responsibility to take the guidance given you today and at these sites that I told you where you can get the information, and to use it. Protect your loved ones, your neighbors, your friends, and your community by washing your hands, by good hygienic practices, by covering your coughs and sneezes, and by staying home when you do not feel well, by not overburdening our healthcare system for things that don't require healthcare system assistance. Your assistance can make all the difference. I'll open it up to questions.
So it seems that given the mild symptoms and the long incubation period as compared to like the flu that hits you fast and hard, it's kind of a recipe for spreading easily and far fast. And given that the first case was around December 1st when the studies I've read is when they think patient 0 was, and China didn't notify anyone until December 31st, and they didn't figure out what it was exactly until January 7th. I read a bunch of different scenarios, and I can't find any way in which, even if it just transmits to each person a few people a day, and a few people is a radically small assumption, it's going to wrap around the world multiple times before January 7th. And so my question or point that I think might help is if you could determine, you could test people for antibodies. And I know numerous people who went down with something in January that was respiratory, that was sort of like the flu in certain ways, but it wasn't the flu, got tested, it was a virus, and they were out for a couple of days. A lot of people just had minor stuff. If you could test people and show that lots of people already have the antibodies for it, people who got sick in January, what you could show everyone is calm down. This has already been everywhere. Everyone's already been exposed. It's already run around the world multiple times and calm down. Because I think the biggest thing at this point that can really cause damage is if people freak out and you have mass hysteria. And so if people think, oh, it hasn't even been to Hardin County yet because there hasn't been a test. I mean, I kind of feel like we've been blessed that there haven't been tests because a lot of people had it and no one knows, and so no one's freaking out. But if we do freak out, people stop going to businesses, people stop going out to eat, people stop going places. All of a sudden, all of these businesses are going to crash, and then all of a sudden you have an economic disaster for something that I would swear is we've all been exposed to, probably 100 more times already. And is it possible to test people for the antibodies and prove that out and then calm everyone down?
That's a really good point. And as far as I'm aware, right now, I don't know if that antibody testing is commercially available. So we don't typically go testing people for antibodies to coronavirus, and more specifically to this version of coronavirus. I think what they're trying to do right now is to just develop the testing kit just to get a screen. And that's part of what's hamstringing our country is the commercial companies are having to ramp up their ability to put out a test that is reliable and can be distributed to millions of people. And so that's part of the issue. Your point about testing for antibodies to alleviate fears, I think it's a great point, but no one on the national level that I'm aware of is talking about that.
So how do we mention that to the CDC or someone to say, hey, let's start, asking for people? Because I know it'll serve two purposes. One, if you could prove it out, it would show, look, it's already been everywhere. Everyone's already been exposed, 99% of the population probably already been exposed, so relax. The other thing though, it would help, I was talking with Chris Dozer, who works in biotech, and he was saying they're looking for people that have it, that they can test for antibodies so that they can work on developing, a shot, right? So you can have an immunization for it. And so it served that purpose as well. So I don't know how you get that word out there, but I honestly feel like it has to have gone around the world multiple times already.
I think through conversations such as this, where we've got representatives from a broad spectrum of society, health officials, commercial leaders, industry leaders, and then we can take it up our chains of command.
And I do know several people, if you need volunteers, I know several people who were knocked down with something in January and would be happy to be tested for antibodies. So, I mean,
There was a mention of screening process that has taken place since late January. Do you know about how many people in the Lincoln Trail District have been screened, and what does that process consist of?
So, the process right now is, that has changed several times, and they're looking at that same guidance that's still on the CDC website as far as travel and signs and symptoms and contact with a known case. They did add a fourth tier to that, which was respiratory issues with unknown origin, if you will, ruling out influenza and things like that. What I will say about that is, right now, we connect providers to the Kentucky Department for Public Health, and they actually will talk to the provider. Sometimes it's the patient. They will actually ask a series of questions. We are not doing that locally. Right now, that's being done by the Kentucky Department for Public Health, and they're making those judgments based on that. I do expect that to change dramatically when private labs are up. So that is the criteria today, and that's being done at the state level, and where the local health departments are kind of acting like a conduit between our local clinicians and the State Department for Public Health in that screening process, and whether or not that person is determined to meet the criteria for testing.
Do you think that it's possible that a patient could slip through the cracks in that? I mean, if they don't meet the criteria that's set forth for being able to even get the test initially, is it possible that they don't meet that criteria but still have the virus?
I think that's possible in every situation in life.
Yeah.
I think there's a margin of error in everything that we do. So I'm sure that is like nothing different than everything we do. There's a margin of error in all the decisions we make. We make them the best we can based on what we know today. I would say that it's even more challenging than normal because it's new. We're still learning. We're still figuring this thing out as we go, and so there's a possibility for error when you're just learning.
I can speak to Hardin Memorial. Every patient at every point of entry in all of our facilities has been screened since the end of January. The screening tool, we are evaluating and expanding that we continue to include those 5 countries, but if there are any signs of flu-like illness, then we will assume that COVID is a possibility.
Thank you.
We're seeing widespread internet help, people offering remedies and homemade concoctions. Who would you send someone to if they wanted to do more than just wash their hands?
So again, go to the sites and the information that we are telling you to. We are united in that. All of our community partners agree that CDC, the Department for Public Health, the local health department, the 1-800 number are the best sources of reliable information. So I would continue to drive that in that way. I am impressed with the transparency that has been going on with this situation. There are routine updates frequently, and there's information being released that I have never seen released before. So I do think that is very up to date, it's very transparent, and that is the most reliable information that you can get at this time.
Yeah, and I would add that the sources that we're referencing are really going to use evidence-based information. A lot of the home remedies, it's really difficult to say if they are effective, truly effective, and using a sample size of 1 or 2 individuals or maybe a family that maybe they got benefit, it's really hard to extrapolate that out to a population of millions of people. So we really have to go on what our scientific data indicates, and right now we don't have a whole lot of that. So, and that's coming out. There are journal articles coming out daily, if not weekly, if not daily, updating people on the status of this in various countries and what their experiences have been.
That's one of our purposes here, is to get that message out. Know what information you're trusting.
Can you talk to people in general? They hear this, they hear no cases in Hardin County, breathes a sigh of relief, but then you even say, we're expecting this, like it's probably going to get here. That causes a little bit of anxiety still, because you don't know when that will come. Can you talk about, people are going to stores and they're buying toilet paper like crazy and hand sanitizer's all gone. Can you talk to people about, like, should that be happening and should our stores be out so fast? It's not here yet, right?
Well, I think we experience the same thing when the snow is coming,
Yes.
or when there is any predicted change in our routine environment. So we can't tell you that the toilet paper will be there next week or not. We can tell you to trust that your healthcare team is prepared. We have the supplies, we have the equipment, we have the skilled individuals to take care of anyone that does come down with this illness.
And I did notice when I was at the grocery over the weekend that all the water bottles were gone. I don't like water bottles myself, and I don't quite understand that rationale because it is not a waterborne illness. It's through the air, but I guess everybody thinks they need bottled water. Our water supply is safe and it is not contaminated. It is in great shape.
I think that probably leads to encouraging people, if you don't really need to be out in large social settings, if you're a high-risk person, to prepare to be home, that's reasonable advice.
And two, supporting your neighbors and your family members. If there is someone in your family that does meet that criteria and that is trying to stay at home and stay well, that we're checking on them and that we're taking care of our own, and that there's somebody there that is making sure that they have what they need to be able to do that.
there are several people from school systems here, and the governor recently said that they should be ready within 72 hours to close down schools. What is your advice to the schools within this community? I mean, do you echo what the governor says? Or what would you say to that?
We work with our schools routinely. That's not something new. So we talk, I look at them and say we talk on a regular basis. Our school systems are ready to do that. They have plans in place for that. They practice those plans from time to time with flu and other events. They have alternate learning methods in place, and so I feel like our school systems are in good shape, and that not only do they have plans in place for that, but they've gotten to practice them recently with flu.
Sharon, you mentioned large gatherings. What is the advice? We're hearing a lot of dialogue around the country and even in the state about cancellation of large-scale events, sporting events and venues. What's the guidance on those sorts of events for individuals that might be involved in the planning and promotion of those things?
Well, we trust we're under the direction of our local public health department. As for Hardin Memorial, we have canceled some events that are public events and non-critical to our mission because our patients are higher risk. You're not talking about healthy individuals that are at the hospital. I'll ask Sarah Jo to speak to any public gatherings.
So as far as public gatherings and advice to schools and different event holders, I think we have to look at what data tells us to do and what our risks are. And when you're in a community right now that has no confirmed cases of this, you know, that's something that we consider when we talk to our school officials and our elected leaders and different individuals that are responsible for community-wide events. There is a recommendation that those over 60 in chronic health conditions and things like that do avoid them now. That is already out there and has been out there for a few days now. As far as everybody else, public health looks at a lot of things, and when we do epidemiological investigations, I can't tell you a hard and fast rule on that because every investigation has a little bit different flair. It depends on the individual who's the positive case. It depends on their behaviors and their activities, where they go, where they work, what their behaviors were prior to. And Sharon mentioned earlier, you know, the original case that happened in Harrison County, that, you know, that happened in a business. That business did not close. They took precautionary measures and they continued to operate, and the health department felt like it was a sufficient response and was in agreement with that. So every case is different, but we look at a lot of variables around what those behaviors are of the individuals affected.
Can you kind of go over the steps that will happen if we do have a positive case to keep everybody protected from that positive case? I mean, if you do have a positive, what would be the steps that would happen from there?
So a positive case was identified, that would be reported to the local health department first. And we would start again with the epidemiological investigation. Where are they? Where have they been? Where did the test occur? And we would start contacting those that needed to be contacted and be part of that response. Those lines of communication are already open, even though there's not a case, so we're prepared to do that. But that is the initial step. As we receive that notification, we begin working with the Department for Public Health along with those CDC guidelines, and we start informing our community partners and advising them based on that individual themselves and their behaviors.
And I can tell you from the hospital perspective, if we are not waiting until the patient is positive, if we have ruled out other illnesses, they're not strep positive, they're not flu positive, then we implement the same algorithm and care protocol that we would if they tested positive. And we're not waiting on the test.
So right
And
now,
a lot of that depends on how ill the patient is.
yes,
as
it
well.
does.
So what we're experiencing right now is patients coming in wanting an evaluation, and they're taking them through that clinical evaluation. They're contacting the state health department, seeking approval for testing, and the state health department is giving our doctors guidance on whether to test or not. So what we're seeing is if they are well enough to be cared for in an outpatient setting, to be sent home, typically the state is not giving us that permission to test those folks at this time. If they're ill enough to require hospital care, they would authorize that, and that's why we haven't really seen any testing here, because we haven't had anybody that sick.
That could change, and if someone receives a test and they're well enough to go home, they would be given information regarding isolation. Isolation is when someone is symptomatic and we need to curb their behavior in populations. And so that information would be given to that individual about isolation. Quarantine is a practice when we know you've been exposed but you don't have any symptoms. You're not sick yet, but we talked about the incubation period. We want to have you restrict your activities in the public for that incubation period to observe you to see if you become symptomatic. Because like Dr. Godfrey said, you can spread this prior to becoming symptomatic. So those are two different public health practices that we would use in those cases when people are well enough to be at home.
Don't spread factual information.
I believe there's, did you have some handouts in the back for individual?
But we can make those available, we have press releases.
Okay, yes, just keep driving people to those reliable sources for accurate information. We thank you for coming today. We thank you for being part of our community and for being interested in what we can do to protect and serve our community at its best.